Okay, so for this self-help video, we're going to use my son-in-law Nick here as a demo, and I'm going to describe to him what to do, and he is going to do it, okay? This video is to help you if you're having some bladder prolapsing. So if you have to urinate frequently, constantly, very urgently, things like that. They tell you, do Kegels, and Kegels will help that, and Kegels do help. But if you're actually having prolapsing, sometimes when you tighten those pelvic floor muscles, you actually kind of make things move in the wrong direction. So this will actually help the ligaments of the bladder and the uterus to move up so that you're making those organs more buoyant. Now, the other thing that this can do is if you're a man and you're having even mild swelling of the prostate, this can really help take that inflammation down as well. You can do this to yourself daily. You want to do this with no oil, no lotion, nothing like that, and generally through either a bed sheet or clothing, because if you're directly on the skin, it's really going to pull the skin. So we obviously have Nick's clothes on. He's going to do this through clothing, okay? So the first thing we're going to do is you're going to take both of your hands, you're going to kind of cup them like this, you're going to come down and find the top of your pubic bone. You're going to drag up toward your navel. So you really want to curl your fingers. You're going to fall off that pubic bone and come all the way up toward the navel. All the way up to the navel, I should say. We're going to do that 3 times in that position. Now the first time that you do it, it may really hurt. Keep going. If you've got inflammation in there, if you are having prolapsing, you may actually feel some discomfort with this. By the second time, you're feeling a little bit less discomfort. And by the third time, you're hardly feeling it at all, okay? And as you do this day to day to day, it's actually the discomfort will get less and less as those organs become more buoyant. Okay, so the next position we're going to have Nick move into is just to the side of the pubic bone. And again, we're going to use both hands. We're going to curl those fingers and go just to the side of the pubic bone. Now we're going to pull up slightly diagonal again towards the navel. So you can see that he's actually in the tissue. You don't want to just drag across the skin. We're going to do this 3 times. You want to make sure that you're actually in the tissue as you do this. The uterus generally sits slightly to the right, so we have started on the right side. So if you're having some uterine prolapsing, this will help that as well. Okay, so as he comes to the end of the 3rd time, our next position is going to be to move slightly over to the right. We're going to come just inside the hip bone here on the right side, and again we're going to move diagonal toward the navel. And we're going to do that 3 times. This entire sequence takes maybe 5 to 7 minutes if you do it in the morning. You can do it 3 times a week. You can do it every day. It just depends on how severe you feel like your issue is and how many times you actually need it. And as he finishes that last run right there, we're going to move to the left side. And we're going to start again just to the left of the pubic bone, and we're going to move up toward the navel. Okay, both hands. And we're going to do this 3 times again. Now, prostate swelling tends to be on the left. So for women, you might feel more discomfort on the right side. For men, you might feel more discomfort on the left side. As you pull up, again, you're going to make that organ very buoyant, so that inflammation is really going to go down. Did we run into our pants? Okay. All right, so our last position is to come just inside the left hip bone, and again, draw up toward the navel. So now a little bit more of a diagonal. Sometimes the clothing or the sheets can get in the way, but of course when you're just by yourself, you just adjust them and move on. All right, so we've done this all the way around the pelvic bowl. Okay. The next thing we're going to do is we're going to do a move that will help loosen the tissue on the insides of the hip bones. So we're just going to take one hip at a time, and we're going to create what we call in massage land medial rotation. Okay, so put your hand to the outside of your hip, right, this hand, and you're just going to kind of roll it in and hold it. Okay, and he's just going to hold that for about 20-25 seconds. On the right side, where he is now, is your ileocecal valve. So the valve between the small intestine and the large intestine, which can get backed up a little bit, can get a little bit inflamed. This move actually really helps that inflammation. So it'll take down a lot of that swelling on the right side. And it generally feels pretty good. All right, you can let that go, and let's do the other side. So he's just going to take his hand, he's just going to roll that hip, and he's just going to hold it for about 20 seconds. On the left side, we tend not to get as much intestinal swelling. This is our descending colon. However, again, if you're a man and you're having that swelling of the prostate, this can really, really help open up the muscles and help release any adhesions that are in there. So maybe your prostate is stuck to some of the musculature that's in the pelvis. Okay, we're going to release that. We're going to do one more thing. We're going to follow the intestines around, and we're going to do moves that will open up the intestinal muscles so that the intestines actually flow. Coming from the ascending colon on the right, what I'm going to have him do is bring his hand up to about here using his fingers. We're going to create an arcing motion so that you're moving like this, arcing up toward, say, the middle of the rib cage. Okay? Just a little bit, not quite that hard, Nick. Come off just a little bit. A little bit less pressure. There you go. And you don't have to move as much, so it's a small movement. And we're just going to hold that again for about 15 to 20 seconds. Now, this move again is really going to help that ileocecal valve and any inflammation that you're having in that pelvic bowl from the intestinal tract. All right, you can hold that a little bit longer if you'd like. We're going to let that go. We're going to come up to the transverse colon, which is just above the navel, okay, and it runs across. And we're going to do the same thing. We're going to take it from the side. Now, notice that I am traveling in the direction of the colon. So you're going to take it from the right side, and again, you're just going to kind of arc it across. And you just hold that for about 20 seconds. So what you're doing here is you're releasing the ligaments of the intestine and the muscle, the smooth muscle tissue of the intestine. It's going to help get rid of inflammation and help everything flow in the large intestine. We're going to do one more. We want to release the descending colon. So as we come across the transverse colon, the descending colon is going to come down here on the left. And again, following the pattern of the intestine, we're going to come to about here, and we're just going to create that arcing again. So you kind of arc down toward the pubic bone. Okay? Nope, a little bit lower. Right about there, yep. Notice that Nick started a little bit high. He started a little bit too close to the ribs. Think about the transverse colon coming just across the top of the navel, so it's about maybe an inch above the navel, and then you're just coming down toward the pubic bone with the descending colon. And you want to just make that arc coming around. Okay? So this is our workup to help with uterine prolapsing, bladder prolapsing, mild inflammation of the prostate, help release some of the swelling in the intestine, just really open up that pelvic area. Thanks for joining us, and that's our video for today.